and welcome to our show For the Love of Animals. We're so glad you're with us today. I'm Darlene Pickford.
And I'm Greg Bauer, and we've got one of our two little buddies with us today. Wicked is here, but Angie was taking a nap today, and so Darlene just left her
We
lay
left her
there.
at home.
But, she'll be back again before too long. But I want to tell the viewers about a couple of upcoming shows. We have a Christmas show coming up, and also one on caring for your horse. So that'll be something that I think our viewers will be interested in. But we've got a super show today, Darlene. Tell us what's going on today.
Well, everybody's going to be on pins and needles today, Greg.
Oh, I hate that one.
That's just a joke, folks. We're going to be talking about acupuncture for animals.
Okay.
And it's going to be very informative and an alternative or another therapy or care for our animals that we need to be aware of. Why don't you introduce our guest, Greg?
Be happy to. We have with us today Dr. Bonnie Jones, who's a veterinarian here in Paducah. And Bonnie's been with us before. And we're so happy that you're here with us today, taking time out for your busy schedule, Bonnie. And we are very interested in what you have to say about acupuncture today.
Thanks. It's a pleasure to be here.
What is acupuncture?
Well, very briefly, acupuncture is the use of tiny little needles inserted at specific points on the body to try to achieve a healing effect. It's been used for literally thousands of years in Eastern medicine, and it's something that in the past 30 to 40 years has become a lot more mainstream in the U.S. as well. It's been used on animals right from the beginning, so we're really kind of late to the game in the U.S. starting to use it now.
How did you get involved or knowledgeable of this treatment?
Well, my personal involvement started well before I was a veterinarian. I had an old dog with very bad arthritis who wasn't responding to medications and actually had acupuncture done by another veterinarian, and that piqued my interest. He did beautifully. So when I chose a veterinary school, I chose the only one in North America that actually includes acupuncture as part of their curriculum. So I was very fortunate. I got that introduced along with my schooling. So I've been able to use it from the very beginning of my career.
Okay, show us a needle.
Okay.
Show us a needle.
Bum, 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 bum. Everyone thinks that the needles are, you get that image in your mind of a huge pincushion. They're very, very tiny, and I don't know if the camera can even see that or not, but I mean just literally the width of a hair, and they're very finely tapered at the end, not at all like a hypodermic needle like we'd be used to getting shot with. Or a sewing needle. They're very different. They're designed to really glide delicately through the skin, and they're so tiny a lot of times you don't even feel them going in. The animals don't seem to notice.
We can both vouch for that, having had human acupuncture before.
Right.
Yeah.
And it is not at all what you think it would be.
No.
Now, and these needles, once they're used, they're not reused, right?
No, absolutely. They're all individually packaged in their sterile containers. They're used one time and then discarded. So each needle that goes into that patient, it's the first and only time it'll be used.
For our viewers that may not know, Bonnie, what is the idea behind acupuncture?
What's the theory?
Well, let me say this as a Western-trained veterinarian. My training is very traditional nuts and bolts science. So it's a little uncomfortable to explain disease in these terms, but basically in Eastern medicine, the philosophy is that disease is a result of an imbalance of energies in the body. And so the idea with acupuncture is that by putting needles in certain places, we can change those imbalances and bring things back into balance and correct disease and promote wellness.
I heard it once explained that like there are meridians or channels running through the body.
Exactly.
And that the acupuncture needle lets energy that's blocked flow. Now, is that a kind of a layman's?
That's a pretty good description. Yeah, the best explanation I ever heard was if you picture these meridians, which are these sort of invisible channels that run through different parts of the body. If you picture them like an interstate highway system, you're placing those needles at specific sites. So for example, if there was a traffic accident and traffic isn't flowing, you're placing a needle there and maybe creating a detour so it can flow again.
And a lot of anxiety. I have used acupuncture myself, so I'm a great supporter of it. With animals, or with humans, did they transfer their knowledge about humans to animals in the United States? In other words, how did it get transferred to do the philosophy to doing are trying this with animals?
There are a couple of different things. Some of the points that we use have been used in farm animals, for example, for thousands of years.
Oh, I didn't know that.
And many of the points that we use are sort of translated from human points as well, and then used on cats and dogs and horses and cows and whoever else needs to be treated.
And we're going to get a chance to see in a little bit now what how all this kind of is done and the sort of thing with a little demonstration there, but that'll be in our next segment. So the other question I was going to ask, Bonnie, was as you route the nerve impulses and move the energy around on the body, how does this help, let's say, with an animal in a healing process?
Well, this is where I can speak more as a regular vet. We know through some very nice scientific studies that the insertion of acupuncture needles increases electronic nerve impulse conduction at those sites. We know that it releases endorphins, which are your body's own natural painkillers.
Oh, really?
We know that it improves circulation. And we know that it can actually improve and speed up wound healing. So, for example, I've used acupuncture in a couple of cases for surgical repair of ugly wounds that we just couldn't get to heal quite right. And those are things that have been very nicely documented in good, reputable scientific journals. So it's nice we have sort of the Eastern tradition and then also some good hard science now tying in with that.
I know I went to a surgeon once, and he had been to China, and it's hard for us to picture a person undergoing full-scale surgery, and the anesthetic was acupuncture.
Right. I did that once, actually.
Oh, yeah.
With a kitty cat when I was practicing in another state.
Oh, my word.
I had a client who was adamantly opposed to anesthesia, and so we reached a compromise where I used lower doses of drugs, and I said, if this acupuncture isn't working to keep your pet anesthetized, I'm absolutely upping the gas. And she said fine, but she asked me to try it with acupuncture first, and we did. I was able to do a surgery on her kitty cat using about 1/10 of the normal anesthetic drugs that I would use, and some very carefully administered acupuncture at the same time. It was a really neat experience. Of course, it took a lot longer than the way I would normally do things, and was a little more costly to the client. So in that instance, it's probably not something I'd do every day, but it was a really neat experience.
Wow.
Yeah.
Probably a lot more comfortable for the patient, too.
She had a great recovery. Yeah, it was a very nice surgery for her and for us as well.
Well, we're just beginning to touch the tip of the iceberg, if you will, with acupuncture, but we want to stop and take a break now and listen to a happy tale about a little cat named Ginger Sue, and she is a character, and you'll love her story. We love her. She's one of ours. Give a listen.
Ginger Sue is a 9-year-old female cat. Her coloring is tortoiseshell and her breed is part Manx and, well, the rest is just who knows. She has no tail and she looks a little strange. She came from Project Hope No Kill Humane Society in 2004 to live with Darlene and Greg. When she arrived, her name was Ginger, but Greg added Sue to give her a good Kentucky name. In spite of having short legs, she can move very quickly. When she came from the shelter, she had lost her left eye due to an infection, but she doesn't miss a thing. She is a very curious cat and wants to be in the center of activity and what's going on around the house. Her moods change at a moment's notice, and she can go from being very sweet to being very nasty for no apparent reason. She gets along well with most other cats in the household, but can be very bossy when she wants to be. At night, she sleeps curled up against either Darlene or Greg and will only allow certain other cats to join her on the bed.
Hi, and welcome back. We're so happy that you're with us today, and I hope you enjoyed that tale about Ginger Sue. She is a little character, if there ever was one.
And a very beloved character. Our house wouldn't be the same without her, I tell you.
We're visiting this afternoon with Dr. Bonnie Jones, who is a veterinarian here in Paducah, and we're talking about the topic of acupuncture with animals. And in our first segment, we talked a little bit about what acupuncture was and why it can be used, and we're going to give you a little bit of demonstration. So, Bonnie, why don't you show us kind of what this might look like, and then we're going to do a little something with Wicked.
Okay. So one thing that we would do the first time and then every subsequent time that we treated a pet is examine some points on their body and some characteristics to see what the most appropriate treatment is. Obviously, we'd take into account what we're treating them for, say arthritis or asthma or whatever. My dog doesn't have a mouth, but we would look at the tongue. There's some information we can glean from that. We would feel pulses in all 4 legs.
Oh.
And then we also would examine one of the meridians that we were talking about earlier, or channels, called the bladder channel, that runs down either side of the spine, and we would be palpating or feeling little points along it for any sort of sensitivity or warmth or anything like that that might indicate there's an issue at that point that needs to be addressed.
Oh, okay.
Once we've done that and kind of got our game plan, we would take one of our single-use needles, and they come in a variety of sizes depending on the pet and the area that we're treating. Open them up, and then we would go right into the point. So for example, on this little dog, we would start with a point called governing vessel 20, which is on the top of the head, and is a main point that sort of connects the 2 sides of the body. So it gets treated a lot to correct imbalances. We put the needle in. The dog didn't even blink.
And you leave the
So depending on what we're treating, we might gently rotate the needle one direction or another and stimulate it a little. And then we would leave that needle in place anywhere from 4 or 5 minutes to, in some cases, up to 15 or 20 minutes. In a typical treatment, we might treat 4 to 6 points, or for some other type of condition, up to 10 or 12 points in the same animal. Frequently, we'll treat on the head, along the back, and then on the legs.
Okay. Now, if the dog had arthritis, say in this joint, wasn't walking well.
Yep.
What would you look at?
Well, it would depend a bit, but we would probably treat this point, and then we might come, say, to the back end of the dog and treat, for example, if he had a hip arthritis, which is really common in older labs like this one. We might treat a point on the hip, and perhaps a couple of points lower on the leg that are associated with long-term pain control. So he might have 6 or 8 needles in him, and those would probably stay in for 7 to 10 minutes. We might also, because back pain is a common corollary with arthritis, we might also treat some points along the back. And those spinal points tend to be treated with slightly larger needles because they're a little bit deeper down in the body.
How would you keep a cat or dog serene enough to stay with this?
That's a great question. I've had patients fall asleep in the middle of their treatment. A lot of my patients, after their 2nd or 3rd session, they come in, I place this first needle, and they kind of go, oh, and they just relax. They seem very comfortable, and any people who've had acupuncture done, it's actually a very relaxing feeling. If I have a particularly nervous pet, I may have their owner pet them or comfort them. I always have their owners with them because I think that keeps the pets more relaxed.
Oh, absolutely.
And I try to work in as non-vet a way as possible. So I'll frequently take off my lab coat, sit down on the floor. If I can treat them outside or somewhere other than in a clinic exam room, that's so much the better because they tend to be more relaxed and more cooperative with their treatment.
Okay.
And then you can sometimes apply a little bit of electrical stimulus to the needles?
Yes, depending on what we're trying to treat, we can apply a very low level of electrical stimulation, and this isn't Frankenstein stuff. This is more like what you would get, say, at a physical therapist for, nerve or muscle stimulation or whatever. So we would attach the clips right to our needles, and then we use this little unit to set our frequency and intensity. And typically we use a very low frequency of electrical stimulation to the point where it's not really perceptible to the pet and it's not causing a visible muscle twitch, just a little bit more stimulation to that needle and a little bit more potent response at that point.
Okay.
So it's just essentially exactly like what humans have done to them with human
Exactly.
acupuncture.
The one thing that we do have to think about is the fact that animals have fur. So some of the techniques they use in human acupuncture that may involve using heated glass cups or things like that on the back, or using open heat sources may not be safe for pets. So we do make a few concessions, but it's basically, same needles, different animal.
Now, we've been doing something on a pet there that is stuffed. But let's see what would happen if we would put a needle with Wicket here.
Okay. All right, Wicket, you ready?
Hey, Wicket.
Mr. Excitement.
Mr. Excitement. So Wicket's a pretty happy and cooperative dog. And this is actually very much like how I would treat him if I was treating him for real and not just on TV. I'd love for him to be sitting on your lap or cuddled up on your couch or wherever he's most comfortable. Hey, Wicket. He's a good boy. And we just sort of take a moment to feel for the points that we're going to treat. And I already snuck a peek at Wicket's tongue and things earlier, so I kind of know what I want to treat with him. I'd palpate that point, and then I place my needle, give it a little tap, give it a little twist, and Wicket's got an antenna.
Yes.
Hey, Wicket.
What you think, Guy?
What you think, baby? Huh? Oh, bless your heart. What you think, Wicket? You okay?
So it's again.
He's wagging his tail.
He is.
It's just like it is with humans. You feel a little bit of it, but
okay.
it's not. It's something you get used to very quickly.
Exactly.
And the relief that you get from these treatments can be all worth all of it. So.
Right.
And sometimes it's immediate.
It can be, absolutely.
It can be immediate. So
Wicket, may I have my needle back?
There we go.
Thank you,
there
sweetheart.
you, Wicket. you were an ideal patient, Wicket. Oh.
Well, we're moving along and that is just absolutely fascinating. And to think that this has been around for thousands of years. And we've just begun to accept it here in the Western world, because it's been in the Eastern culture, the Chinese particularly, for all these years. And the benefits that you can have from it are so wonderful in most cases. It's not a cure-all by any way, shape, or form.
And certainly choosing your cases is important. And I would never reach for acupuncture to the exclusion of everything else. But in my hands, it's just one more tool in my tool bag to treat these patients.
Okay. Well, we want to talk a little bit more in the next segment about some of the things that you would use it for, some of the things it wouldn't be good for, and some things like that. So we want our viewers now to have a chance to hear a second happy tale today. This is about Callie. Callie is one of our mischief, the goddess
queen
of
of
mischief.
mischief.
No, goddess of mischief. That's where her name Callie comes from. So give a listen.
Callie is an 8-year-old female cat. She is a domestic long hair, and her beautiful markings make her a calico. She was an abused cat that Darlene and Greg found at Project Hope No-Kill Animal Shelter. When she came to the shelter, she had a broken hip that was caused by being drop-kicked like a football by a cruel group of kids. Her injuries have completely healed, and she has a normal life. She loves to chew on cut flowers, and it is a real challenge to keep her away from them. She is very curious and always looking for mischief. Her name is Callie because that is the name of the goddess of mischief, or so we think.
Hi, and welcome back. We hope you enjoyed that little tale about Callie. She and Ginger Sue are two of our biggest characters in our herd at home, but we just love them both, and they're so wonderful to have. Well, this afternoon we're talking with Dr. Bonnie Jones, a local Paducah veterinarian, who's talking about acupuncture with animals. I will get this right in a minute. And we've just had a little demonstration on how this might be done, including a little live demonstration with Mr. Wicket here. He's back to sleep now. He's happy. So before we go any further, Bonnie, our viewers may want some more information about acupuncture with animals. How can they get in contact with you?
Sure. They can reach me by phone at 270-556-8989. I think you're contagious. Or online at www.purchasemobilevet.com.
Okay. And before too long, you will have a website up there that they could go to.
And do we want to include an email address?
Yeah, I can be emailed at drjones@purchasemobilevet.com.
Okay, well, good. So if you want more information about acupuncture, those are some ways you can get to it.
We've been talking now about what acupuncture is, and we've seen how it might be done. What are some of the medical conditions that acupuncture is especially good for, and what are some where it's not terribly useful?
Well, by far and away, the most common time that I'll use acupuncture is for animals with arthritis, either patients who don't tolerate conventional medications particularly well for whatever reason, or for whom their owners are concerned about the side effects of those medications, or for some of the patients where that's just not working anymore. They may have chronic pain or other issues that aren't well managed. I'll also use it basically to treat conditions where other stuff doesn't work. So classic examples would be things like asthma in horses, and to a lesser extent in kitty cats. There are some conditions of the mouth that are specific to cats that don't respond well to much of anything, but in some cases acupuncture can be very helpful. There's a condition called feline lymphocytic plasmacytic gingivitis stomatitis
Okay.
complex.
All right. What does it look like for us commoners?
It's basically an over-response by the body's immune system to plaque bacteria on the teeth, and so these kitty cats will get very red, painful, ulcerated, sometimes bleeding gums, and they'll not be able to eat. It's a really nasty condition, and conventionally we would treat it with steroids or even removing all the teeth in the mouth. Some patients can be managed very well with acupuncture for that condition. I've also treated patients with epilepsy, a lot of pain patients, and occasionally animals, older pets with degenerative conditions like kidney failure in kitties who maybe just need a little something to increase their appetite, increase their pep and vigor.
Okay, if they were an older cat and you did a treatment, I know this is hard to, how long would it last?
There's a bit of a cumulative effect. So for example, the first time I meet a patient and start treating them for, say, arthritis, I might treat them weekly for 4 or 5 weeks. And then after that, we start stretching out the treatment intervals. Some patients can be maintained very comfortably with a treatment every 4 to 6 weeks. I have one old dog right now who I treat every 7 days because if we go longer than that, he just can't get up and around. And I have some patients who I'll treat maybe, particularly the arthritis patients, every month to 6 weeks in the wintertime, and then I don't see them all summer because they're pretty comfortable. And then we come back in and resume treatment when the weather gets cold and damp. So it's really variable. And there are some conditions that we may treat for more acute things like injuries or post-operative healing. We may just treat a couple of times and be done with it. The effects last, we know, a lot longer than the time the needles are in. As far as pain relief and healing, we can see effects for, you know, days to weeks to months in some cases.
Wow. Okay. And how about, what's the difference between small animals, treatment for small animals and large animals, say like a horse versus a dog or a cat?
The biggest difference is the size of the needles that we use.
Okay. Because
these little weeny needles will just not go through a horse's skin very well. They'll bend. So we do tend to use slightly larger needles.
That makes sense.
And we're often treating different conditions. In horses, I'm often treating things like back pain or asthma. In cattle, we're primarily treating things like mastitis. For example, in organic dairy herds, they may not want to give antibiotics to a cow who has mastitis, but we can treat her with acupuncture to try to improve it. But certainly the size of the needles, and we'll often do a little bit longer treatment in those animals as well.
Okay.
Oh, go ahead, Greg.
Oh, well, I was just going to say, are there particular conditions where acupuncture might not be appropriate at all? It's not good for everything,
Absolutely.
Is it?
And there are certainly any animal who is too aggressive to be handled by people on a regular basis in an appropriate way is not a good candidate for acupuncture. We don't want to be sedating someone to be needled, for example. Patients who have big open wounds or right over a broken bone, we might treat that patient, but we would avoid that specific site. And patients who are pregnant or who have any type of cancers can be treated, but they have to be treated very carefully and from a little bit different perspective, because if we treat them incorrectly, we can perhaps endanger the pregnancy or make a cancer grow more quickly instead of providing palliation. So there are some definite cautions there. And to my mind, if an animal can be easily treated, for example, if your dog has an ear infection, well, I could treat that with acupuncture, but I could treat it a lot more quickly and effectively using antibiotics. And in that case, I would reach without hesitation for the antibiotics. So I think it comes down to choosing the cases appropriately and using some good common sense and clinical judgment.
Okay.
Now, that's common sense from a vet's perspective.
Exactly.
Right, not mine, okay. I do know of some cases where the animals, they have allergies or asthma, and they're having a problem with the sinuses, their little sinuses are degenerating.
Yep.
Might that kind of case be appropriate for acupuncture? Absolutely, and in fact, the first acupuncture I ever had done on myself was for a sinus condition, so it can be extremely effective. Particularly, if we have an animal who's not responding to other types of treatments, or we might use them all together. They might go on, for example, an antibiotic and something to clear their sinuses and get needled at the same time to try to get a faster and more effective result. But suppose an animal's been on all kinds of medication and now they're wearing off. Right. And that's nice to know. We always have alternatives.
Sure.
I just can't believe time's very quick. What do you want? What do you want our client, or your clients, or our audience to remember about acupuncture?
Well, I would just say that, you know, it's one more thing to remember as an option for your pet's care, and it's certainly something that should only be performed under the guidance of a veterinarian or referred through a veterinarian, because that way we can really ensure that it is an appropriate choice for your pet. But when it's done under the right conditions, it's a very safe and in many cases very effective way to help our pets feel and feel better and live longer.
It's just another alternative.
It's just another tool, exactly.
Great. Well, I'll tell you, this has just been a totally fascinating show today,
Yes.
Bonnie. I know Darlene and I learned an awful lot about acupuncture
Yes,
with
and
animals.
we've done acupuncture ourselves, for,
with-
or had it done for years on
And,
quote maintenance. But
and we know that our viewers have a much better idea of just what it was. Hopefully they've kind of wondered, and maybe it's be good for their pets. So this would be something that to consider as an alternative. And we want to thank you so much today for coming by and sharing time from your busy schedule to tell us about this. And this has just been very interesting and very informative, I think, today.
thank you so much for your planned demos too. That
Yes.
it was so
Absolutely.
helpful to see all of this. Well, time passes when you're having fun, doesn't it,
I
Greg?
know it. I know it does, Darlene, and I.
Wake up, Wicket.
Yep, time. Mr. Excitement's
Time
up
to
from
go,
his nap,
Wicket.
but it's time for us to sign off again. And in closing, I'm Greg,
I'm Darlene.
and we want our viewers to remember what we tell you every time. Give your pet a little extra love today and
And every day.
See you next time.
Bye.